And the number one I want to practice is think of pain as neutral. If you accept pain, it ceases to become your enemy. Yun yung sinasabi ko lagi. So you treat the pain as something is not in harmony in your body. And now we're working to harmonize whatever is not in harmony. And we're looking to ease whatever is in dis-ease. But for that to happen, you have to stop resisting pain. Yeah. Kasi pain is neutral. Kumbaga. Once they start accepting that concept that it's neutral, stop fighting it, nagde-decrease yung pain. Which is true. So then after that, yung dis-ease, nare-relax. And I always, to my patients, I always say, nothing can resist a non-resistant person.
This is PT Meal Podcast, where we ingest and digest physical therapy information from physical therapists around the world with a Filipino twist. With your host, Johan De La Paz, a Filipino physical therapist who has worked in different practice settings from the Philippines and here in the US. Let's indulge and satisfy our cravings to learn and be inspired.
Welcome back to PT Meal Podcast, a buffet of play, therapies, movement, exercises, activities, and leisure, all packed in a hearty conversation of physical therapy profession and practice with a Filipino flavor. I am Johan De La Paz, your host. Welcome back to the banquet. So for those who are new to the podcast, again, this podcast is available in your favorite podcast streaming apps: Spotify, Apple Podcasts, Google Podcasts, Anchor, iHeartRadio, Amazon Music, and many more. If you're listening to a podcast using a podcast app that you can find PT Meal, just let me know. Then I'll try to do something about it. You can also watch us in YouTube. So most of the full episodes are also there. If you want to stay updated on fresh episodes, interview snippets, research abstracts, and educational materials, or infographics that I usually put out, follow the podcast's social media accounts in Facebook, Instagram, LinkedIn, and Twitter. And all links and content are also available in the website. Visit ptmealpodcast.com. All right. Now, let's go on with the show. So my guest for today is not new to the podcast. She has already been a guest last year in our June Pride edition. We talked about physical therapy and the LGBTQIA plus issues and concerns. Now we're going to get to know her work as a physical therapist. She is working in a holistic outpatient clinic where they treat patients, including their mental health. They would also address their issues, whether physical or psychosomatic. So we are going to get to know more about that because that's really interesting. So, I mean, if you've listened to this podcast, and I've mentioned this before, since working in my new job, I've been interested in physical therapists practicing in psychiatric, behavioral, or mental health space. So I am trying to raise awareness in that. So this is going to be an interesting topic. So welcome back to the podcast, Reg.
Hi,
how are you tonight?
Good. How are you?
I'm good. And as I mentioned, you were here before, and this time we are going to really get to know you and your work and your practice. But before that, could you introduce yourself to us and the audience? How did you become a physical therapist, and what led you to your current practice now?
I initially took up physical therapy as a pre-med, so I wanted to become a doctor because my grandfather's a doctor. So, but one thing led to another, and I ended up not going to med school. So I ended up going here sa US to just practice physical therapy because from the time I was in school, very lucrative yung maging PT. You know, you can go to the US immediately, and it's the fastest way to get a career instead of staying in the Philippines. So then when I graduated 2011 from UST, and then 2016 is when I came to America. And then here in America, I started working first in the hospital setting. So I did inpatient acute care, and then outpatient, and then some trips to psych ward and inpatient psychiatry. And then I moved to New York, and then I moved on to mostly outpatient home health. And then now here in New York, the emerging trend is what we call boutique clinics. So
Mhm.
these are very specialized clinics. Now they choose whatever specialty they want to serve. So boutique clinics are like one-on-one with the patient.
Wow.
And then it's highly specialized in the sense that, for example, if this clinic is more of wellness or holistic,
Mhm.
they offer acupuncture, chiropractics, maybe massage, and then
Mm.
some physical therapy. And then patients come in for 1.5 hours. So they get all of the services. And then there's another one that I've partnered with. She's a chiropractor, and then she has an acupuncturist, and then they're more into women's health.
Mhm.
So it's mostly pelvic floor, hormone balancing, fertility, those kinds of things.
That's a
So
good idea.
yeah, so here in New York, it's getting popular. Clinics
Mhm.
that are highly specialized. I've seen a clinic highly specialized in arthritis.
Uh-huh.
So they have acupuncture, a chiropractor, licensed massage therapist, and physical therapist, all only addressing arthritis. It's an arthritis-based practice. So
Wow.
yeah. So the one I'm working at now is a holistic-based practice.
Mhm.
So we are more into helping the patient avoid surgery, helping the patient avoid needing to take medication.
Mhm.
So yeah, that's the physical therapy practice that I'm in, and that's how I started.
Oh, wow, wow, wow. So when you said you help patients avoid surgery, do they come there as a second opinion that like they're some doctor probably said, "Oh, you're gonna need surgery," then they don't want
Most of them.
surgery. Oh, okay.
Most of them, ayaw talaga nila ng surgery. They're highly opposed to getting surgery
Uh-huh.
for many reasons. Like some of them, they just really don't want to be under general anesthesia, or they don't want to be cut open. Some of them are highly opposed to it because of the recovery time. Some of them, of course, the number one is financial.
Mhm.
So there are many reasons,
Mhm.
but most of them are for second opinion. They come to
Oh.
us, they land in the clinic because they need a second opinion. Maybe there's something else we can do so I don't do surgery.
Mhm.
Yeah.
Ah, okay. Oh, that's neat. That's neat. I like the idea of boutique
Mhm.
clinics. I could see that happening now in the Philippines.
Yeah.
Um,
Especially in the Philippines where hindi tayo restricted by
insurance.
insurance.
Yes,
So you
exactly.
can highly specialize in something. Like you can
Yes.
offer. I remember in the Philippines before I left, I had a business partner. Um, by the way, I started a clinic with a business partner in the Philippines. And
Mhm.
one of the ideas was to actually focus on practices that haven't been introduced in the Philippines yet. Like so many people don't know na physical therapists treat vertigo. How many people
Exactly.
in the Philippines have vertigo? They don't know
Exactly.
where to go. so
Right.
so yeah, highly specialized clinics. Right now, dito sa city, it's very popular.
Mhm.
More and more insurances are covering it. So it's booming.
Right. Because people, I think in the Philippines, the only the only specialized practice in physical therapy that you can do by yourself is in sports.
Yes.
Because that's
Uh-huh.
the very
Yeah.
popular one. But
Yeah.
they don't know the idea that this can happen in other specialties, like what you said, balance and vertigo. You can
Yep.
do also pelvic floor,
Pelvic floor, women's health,
women's health.
arthritis.
Yeah.
Also, what else can you actually anything highly specialized you can
Mhm.
introduce.
Even I mean pedia. I
Workplace,
mean
like people who only have workplace injuries. Like,
exactly. Mhm.
yeah, maraming there are so many like right now the most common in the Philippines is just pediatrics
Mhm.
or outpatient general.
Mhm. Yeah. Yeah.
So
In
yeah,
sports,
here
and that's
it's
it. Yeah.
yeah, here there's actually specialized practices that they only deal with runners. I
Mhm.
know that
You can go
uh,
really niche here.
yes, like runners lang yung market. I know a PT who works with Equinox.
The gym.
So yeah,
Mhm.
so most of their very athletic clients here in New York, there's so many people into
Mhm.
running.
Uh-huh.
So their client base are mostly runners, common
Uh-huh.
runners, injuries.
Mhm.
So all the interventions for runners. And word of mouth, because
Right.
runners are usually in one whole community. So now
Exactly.
they're all participating in this clinic, and then the insurance is all done, blah,
Uh-huh.
blah, blah. It's a good practice. They make a lot of money.
Uh-huh. I had one guest before. I'm sorry, I forgot her name.
Yeah.
She's also practicing in New York, I
Uh-huh.
think, and she specialized on weightlifting. So
Mhm.
our clients are weightlifters, and
Yep.
again, also word of mouth. Uh, People know people, so
Mhm.
she gets a lot of referrals from that. She's also part of the community. She also
Yep.
lifts weight, so
Yep.
that makes her, part of the community, easy for
Mhm.
her to go into that. So I
Yep.
mean, yeah,
There's
that's
a clinic here that's called CrossFit Physical Therapy.
wow. Okay, so I let me wonder, who's their population? CrossFitters,
Believe it or
yeah,
not, sobrang dami talagang CrossFit
nakakatawa.
fanatics. So yeah, yeah. So yeah, boutique clinics. Yun
Mhm,
yung trending ngayon dito.
yeah.
And I landed in one.
And I think that's with more entrepreneurial spirit in the Philippines. I think that's gonna catch on really
Yes.
soon.
Yep.
Uh,
Mm-hmm. Makauwi
Um,
na nga.
that's the dream.
Yep.
I see a lot of we're going off topic now, pero I see a lot of
Yeah.
I see a lot of tawag dito, new clinics being established by young therapists. I was like, oh wow, that's neat.
So Philippines?
The Philippines. Oh,
Oh, wow.
I was like, mga younger therapists that are really bold.
Which is good. Because
Mhm.
it is, if people aren't going to start anything new, nothing is going to change.
Exactly.
So sa akin, okay yan.
Yeah, that's true. That's true. A lot of things are being introduced. A lot of techniques are being taught now there,
Mhm.
or they intentionally go out of the Philippines to study them and bring them to the Philippines. I'm like, oh, okay, that's nice. Ang ganda ng mga ideas na ganun.
Yep.
All right, so going back to the topic.
We digress.
Yeah. So going back, your practice is, as you mentioned, holistic, and you also
Mhm.
deal with uh, patients that may or may not have issues with their mental health. So describe
Mhm.
to us, how does that, or how does mental health go into your practice?
So, first of all, the team I'm working with, I'm the only physical therapist. We have a doctor of acupuncture, we have a chiropractor, and then we have a massage therapist. Patients come in, and then the full session is 1.5 hours.
Mhm.
So, during intake pa lang, you have to ask questions, mostly holistic questions.
Mhm.
I'm not gonna say, it's not really leading, but for example, I ask what happened, the usual, like MOI, what happened to you, what did the doctor say, what's your job, ganyan.
Mhm. Right.
So you ask the basics, and then after that, you need to ask, like, there are questions dun sa guide namin.
Mhm.
There are questions such as, are you in a lot of stress right now? Did you have a recent life event? Do you think there is other reasons for you to feel this pain? How is this pain affecting your life right now? How is it affecting your work, family? And it's very detailed. It's actually good.
Mhm.
So those other questions, apart from what physically happened to you,
Mhm.
we ask it. We ask.
Mhm.
So I actually don't go that deep. Like our acupuncturist goes in deeper, because apparently acupuncturists have to work with energy blocks,
Mhm.
or if there's like deep emotions vented up.
Mhm.
In traditional Chinese medicine, they believe that if you have emotions that aren't released, of course, it's toxic,
Mhm.
and then it turns out to alter your cells,
Mhm.
and then it can result in like growth abnormalities, all of that stuff.
Mhm.
So with me, I mostly focus on how is other factors other than the physical stuff you said. How are other factors affecting the pain you feel?
Mhm.
So it's very tricky kasi pain is highly subjective. You can
Mhm.
never say to someone, pakiramdaman mo kung gaano kasakit to. Di ba?
Mhm. Right.
So you have to ask, what are other things that could possibly be causing your pain?
Mhm.
And you'd be surprised, mas mahaba yung intake mo dun sa part na yun. kesa dun sa ano nangyari sa kanya.
Mhm.
What work are you doing? In your work, do you have to sit or stand the whole day? Are you walking a
Mhm.
lot? What are your activities? What are your hobbies? More than their answers on the physical side, they have more answers for the non-physical factors. Like, for example, we have a financial situation right now. I really don't want to be sick, or I just went through a breakup, or I just got laid off from my job, or I
Mhm.
just moved here from my home state, or
Mhm.
I'm undergoing like a lot of pressure right now in terms of work, career. So many mental things that are going on. And I'm sure lahat tayo as physical therapists, what happens during a session is sometimes patients really just want to talk to somebody. Diba?
Mhm.
They go into conversation and then all of a sudden, hindi masyadong mahirap yung exercise.
Mhm.
Or hindi masyadong masakit when you ask
Mhm.
them to move or you ask them to stretch. Because there's a big correlation. Like in our practice, we believe that there's a big link between what is going on mentally with the person and what they're feeling physically.
Mhm.
So yeah, it starts with the intake. And so you carry out your plan as a physical therapist. Like, okay, say for example, we have a patient who has severe herniation, like lumbar herniation, multi-level, referred to surgery na. They don't want to undergo surgery for financial reasons. So that's one stress already. So another is no one will take care of them. Wala silang family dito, ganyan. That's another form of stress. The time they have to take off work, that's another form of stress. Who's
Mhm.
gonna take care of me if I can't help myself to the bathroom, ganyan, ganyan. All of that increases the person's pain. So first of all, we break it down for
Mhm.
them. We tell them that we're gonna do our best to help you with your pain.
Mhm.
We're gonna see if your pain can be relieved with yun nga, what you're gonna do, the
Mhm.
exercises, the manual therapy, and then of course yung HEP niya. And
Mhm.
then the acupuncturist comes in. And then the acupuncturist actually, because traditional Chinese medicine siya,
Mhm.
very detailed yung treatment. And I really work with a very good acupuncturist. So napipinpoint niya like, nandito yung tension ng body mo. Like you're shifted this way or you have a blockage on this, like your kidney's not working well. And true enough, it's so amazing paano na-uncover ng if your acupuncturist is really, really good. She can start with just, so I can see that you have tightness in your low back muscles. And then I think your kidney is affected. Like she hits a point and then the person says, ow. And then she's like, that's your kidney. And then the next question is, do you sleep enough? Tapos sasabihin ng patient, no, I actually sleep just like 3 to 4 hours. See? Ganyan, ganyan. I can tell you usually eat meat. Ganon. And
Mhm.
then, oh yeah, that's true. I don't really like vegetables. Ganyan. The whole treatment already exposes a lot of things that aren't really related to paano ka nasaktan or.
Mhm.
And so after doing the intake, the chiropractor also does his thing. Tapos yung the massage therapist performs like soft tissue, 10 minutes on the patient. Tells the acupuncturist ano yung na-uncover niya. Na yung acupuncturist na yun, kausapin kami ni chiropractor.
Mhm.
Ito yung nangyari, ganyan. Ito yung blockage niya, ito yung ganyan, ganyan. Tuloy enough, pag nag-stretch ka dun sa area na yun, talagang sobrang sakit for them. And then, it all comes together.
Mhm.
And then, there are some sessions that you give them a treatment. Sometimes they just break down, they're crying. And they're crying because they're relieved.
Mhm.
Panood mo na yung, sino tong chiropractor on YouTube na, di ba, they cry, mga pasyente na naiiyak sila.
Mhm.
Kasi sobrang tagal na nilang in pain. Tapos pag
Mhm.
na-release lahat ng pain nila, parang feeling nila yung
Gumaan yung pakiramdam nila.
nabunutan ng tinik.
Right.
Saying. Yun. Kasi other than na alis yung burden physically, natatanggal na yung burden mentally. Kasi may nag-encourage sa kanila na, yes, you can recover.
Right.
Now, there are also cases, meron talaga kami na-uncover na psychosomatic talaga.
Mhm.
Yun yung mas interesting ngayon. These are patients na pumapasok sa clinic that they're really, really in pain.
Mhm.
And the worst one I've seen is, ang dami niya napuntahang doktor. More than 10 na.
Okay.
Na-refer na siya neurology,
Mhm.
physiatrist,
Mhm.
orthopedic, psychiatry. Tapos
Mhm.
na-refer pa siya to a vertigo doctor, rheumatologist, immunologist. Lahat normal.
Mhm.
Pero araw-araw in pain siya talaga.
Okay.
So, hindi namin maintindihan kung ano yung cause.
Mhm.
So, of course, again, ang unang nag-dive in is yung acupuncturist. So,
Uh-huh.
nag-investigate siya like, is it something mental going on?
Mhm.
Turns out, yung kapatid niya nag-suicide.
Okay.
So, after mag-pass away yung kapatid niya, then siya nag-start magkasakit.
Mm.
Hindi siya natutulog. Hindi
Mhm.
siya makakain.
Mhm.
Hindi niya siya makakome into terms with the grief.
Mhm.
To the point na nagmamanifest na to physically. Hindi siya
Mhm.
makapasok sa work.
Right.
Tapos yung treatment na ginawa sa kanya ng acupuncturist, it's sort of really for releasing the grief, clearing out like yung channels of energy,
Mhm.
ganon.
Mhm.
And then for physical therapy, mainly I worked on manual kasi
Mhm.
laging ang complaint niya is neck pain. Like
Uh-huh.
neck pain lang talaga. Laging naka-center sa neck. And then some endurance activities kasi wala
Mhm.
na siyang ginagawa.
Mhm.
Stagnant siya lagi. Basically, sabi sa akin ng acupuncturist, very stagnant yung patient natin.
Mhm.
Hindi, wala siyang form of exercise, wala siyang very sedentary.
Mhm.
So, do something para ma-boost yung umikot yung dugo niya. So, then yung chiropractor mag-a-adjust. So, na-relieve siya.
Mhm.
So, yung combination ng all of those treatments, eventually, and then ina-unearth niya every session, we ask about how are you feeling? Is it improving? Of course, you're also there not only as their not only as the practitioner,
Mhm.
but you also kind of give them support on the mental aspect of their condition.
Mhm.
And after I think 3 months,
Mhm.
and I think finally yun na-clear up na yung grief niya and naturuan
Mhm.
siya how to process everything. Completely nawala yung symptoms niya.
Wow.
Completely. And then nagpadala siya ng gift sa clinic and then
Mhm.
sinabi niya na I think a big part of it was that ayaw niyang makipag-usap with somebody that he knows. And
Mhm.
it was comfortable for him to talk to people that were caring for him
Mhm.
in this situation. Yung team kami, we were working on him.
Mhm.
And sinabi niya, you're the first group of people na hindi ako dinismiss.
Mhm.
Just because medically, wala silang makita.
Right.
Kasi sabi niya, there's nothing worse for a person hurting than to be told there's no reason for you to hurt.
Mhm.
Sabi niya, just because the doctors see nothing doesn't mean I don't have pain. And you're the first people who believe that something was really going on or something was wrong. There's an imbalance. There's some sort of dis-ease.
Mhm.
So yun yung practice.
Uh-huh. I like what you said when you emphasize disease. So
Yep.
it's not, you know, when we say disease, it's like a condition, but generally it's not the feeling of not being at ease.
Yeah.
It's nice.
Yeah.
Um, um going back to what you said, ang daming tumakbo sa utak ko.
Mhm.
I like that it happened. Those questions happened at intake right away
Mhm.
because it opens the patients that pain is not just something that is physical.
Yeah.
You already by asking it at the beginning, you already introduce that pain is not just something physical. It also is coming from the brain, from our mind,
Mhm.
our psyche.
Exactly. Your
So
emotions always affect your physical being. If there's
exactly.
anything I learned dito sa practice na to, is that emotions actually can affect you physically.
Mhm.
That's why pag sinabi sa'yo na mag-imagine ka ng scenario na nakakatakot, bibilis yung heart rate mo.
Mhm.
And then, for example, I remember in physiology, bakit masakit ang heartbreak?
Mhm.
Diba? Bakit pag may sinabi sa'yo na masakit or binrekapan ka, you
Mhm.
literally feel chest pain.
Exactly.
Kasi there's a moment na nababawasan ng oxygen yung cells ng heart. It's not enough to cause a heart attack or maybe I don't know. Siguro for some people, yes, it's enough to cause a heart attack, but it really does affect you.
And
So,
there's also a heartbreak syndrome, a literal physiological.
yeah, heartbreak syndrome. Exactly. Yon.
Mhm,
So for us as physical therapists, we cannot deny that there is actually a relation
mhm,
with mental and emotional,
mhm,
your mental and emotional health to
mhm.
your physical health. And
Right.
actually, there are so many published evidence
Mhm,
out there na it's true
mhm,
that your mental well or your mental health and your emotional health is directly linked to your physical health.
mhm. Right. And I like it because when we ask during our subjective interview, not even the screening, we always in our head look at the physical aspect. What can be the cause of it? We ask for aggravating factors, redeeming factors,
Mhm.
but it wasn't taught to us that we have to expound on their current situation
Mhm.
and stuff like that, which points now to the current model that we should be doing is the biopsychosocial model,
Yep,
so
exactly.
the psychological and the social, sometimes people also include spiritual as well in
Yeah,
model that could really affect the person and the rehab process. um
there's such a stigma
mhm,
around mental health kasi. Kasi
mhm,
we're just transitioning into the generation who accepts mental dis-ease
mhm,
as valid reasons for you to be sick.
mhm.
Coming from a generation who's always been told, iniisip mo lang yan.
Yeah,
Or nasa isip mo lang yan. Or
right.
isipin mo lang okay ka. It is true. You
Mhm,
can think your way to sickness and you can think your way to health. It's true.
mhm,
But for people who are already there, that they already thought their way into sickness,
mhm,
you can't tell them, huwag mo isipin na may sakit ka.
mhm. Yeah,
They already did it. So,
right.
tulungan mo sila ngayon to get out of it. And the first step is getting rid of the stigma.
Mhm,
That if they made it up in their head, kaya rin nilang tanggalin. Sometimes no.
mhm,
Sometimes hindi nila kaya. That's why
mhm,
we encourage people that if you do need professional help, you need to go and
mhm,
get professional help. Diba?
mhm,
Get all the help that you can get. Whether it's support from friends, going into therapy, getting more active, finding someone who can be your confidant.
mhm.
Anything that will boost your mental health, do it.
Right.
Like it's so important right now that we remove the stigma on mental illness
Mhm.
because it has claimed so many lives actually.
That's true.
Yeah.
That's true. And as for us trained, some years ago,
Mhm.
that it, it wasn't emphasized to us that we have to look into the psychological factors that can affect
Yeah. Hmm.
physical therapy. We would just once we hear something about the psyche,
Hmm.
we'll, we'll just say, all right, make sure that you see your doctor about it, and that's it. We,
Yeah, you
we
refer out.
refer out right away. I
The
mean,
easiest.
we don't even try to explore that idea because in our heads we're physical therapists. We only deal with the physical aspect.
Hmm.
Anything
Yeah.
mental, anything psychological, it's not in our hands.
Yep.
It's not part of a scope.
Hmm.
But we forget that we're treating a person. You can't exclude that box from that
Exactly.
person.
That's the problem, yeah, with the traditional model of medicine and
Mhm,
healthcare is this is your condition,
mhm,
this is my specialty, so
mhm,
this is the only thing I'm going to treat.
mhm,
Now, if you feel anything else, I have to refer you to another
mhm,
specialist, which is true.
mhm,
Like, of course, if you're a kidney doctor, you wouldn't mess with something that's a heart issue.
mhm,
Pero when we're talking about something all encompassing like mental health,
mhm.
whatever field you're in, kahit ano yung specialty, subspecialty mo, a person's mental health will always be attached to it.
Yeah, exactly.
And we can say that it's not true. We can deny that all we want, but it's true.
Mhm,
Haharap sila to every doctor bringing the same mental stuff, bringing the
mhm,
same mental baggage. And until you find a way to ease the patient and to reassure them that, first of all, they can be helped. That's the first thing a person needs to know is matutulungan ka.
mhm,
So once they come to you for help, you reassure them that they can be helped,
mhm,
and then you get them to actually open up everything, not
mhm.
just masakit yung ganito ko.
Mhm.
Okay, what else is going on? Other than masakit yung balakang mo, or masakit yung leg mo, or masakit yung tuhod mo, what else is going on?
Mhm.
It actually, in my experience, like of course, anecdotal, but in my experience, when I get into it with the patients, their situation, their family life, their current, when they're willing to open and I give them that space,
Mhm.
shorter yung treatment times.
Mhm.
Sometimes 6 weeks, they're done.
Mhm.
Sometimes chronic pain that has been there for 2 years, tapos na sila in 12 sessions.
Mhm.
So it helps a lot going into the mental aspect of why your patient is in pain. And I highly encourage lahat ng physical therapists to actually educate yourselves. You know, there's so many continuing ed courses now on mental health in the
Right.
allied health practice as physical therapist, or you can also learn about cognitive behavioral therapy. That's what I did actually. I got interested in it. So
Mhm.
I went and took an online course and I got certified
Mhm.
on cognitive behavioral therapy, and it's very useful because
Mhm.
you teach them how to process yung thoughts nila and
Mhm.
yung, you know, because sometimes, well, not sometimes, this is what I learned is like everything starts with a thought.
Mhm. That's true.
So if you can teach a patient paano i-redirect yung thought,
Mhm.
everything else that comes with the thought gets redirected to another
Mhm.
way.
Right.
So I'm not gonna say you're manipulating them to think another way, pero you're leading them to the right space.
Mhm.
Like a lot of people, when they come to the clinic, they think that dead end. I need
Mhm.
surgery, and then I just need to see if there's something else you can do.
Mhm.
They're like, if you can, please help me. Parang ganon.
Mhm.
So when they come in and then you tell them, first of all, we have to come into agreement that we're on the same page. Na yes, we're gonna find everything that works.
Mhm.
And second, we're gonna see ano pa yung ibang problems. Why are you having this pain? Why are you having this condition?
Mhm.
And then third, ano yung lahat ng magagawa natin. We will exhaust everything. We will help you figure this out. We will help you find out what's going on. Because there's nothing more comforting than knowing that your practitioners care about you.
That's true.
That's why in boutique clinics, 1:1 lagi ang patient.
Mhm. Right.
Because it actually helps the patient open up completely about their condition when they know that the attention is nasa kanila lang.
Mhm. Right. You said you studied CBT, cognitive behavior therapy. That's something that I want to go into as well, aside from DBT or ACT, whichever is less. I mean, what do you call it? Less expensive.
Less expensive. Well,
So,
now yung cognitive behavioral therapy and other psychological techniques
mhm.
and therapies are available anywhere. Actually, you can learn for free on YouTube.
Mhm.
There's
Mhm.
so many people willing to certify you as long as willing ka mag-practice.
Mhm. Right.
Yeah. So you're interested.
Yeah. Yeah.
Yeah.
See, I've been listening to a podcast and they introduced that and the different therapy CBT, ACT,
Mhm.
and DBT,
Yeah.
and they found that those interventions plus physical therapy
Works. Yep.
works. So you being certified in CBT, do you um how do you maintain the physical therapy aspect and not going too much into um
Psych.
the psych? Yeah,
The psych.
that's I think that's the a gray area and problem, or
Yeah.
what people want to avoid is stepping into someone else's profession.
Mhm.
How do you maintain that boundary?
So for our clinic, what helps me maintain the physical therapy aspect of the practice is we actually have very clear roles.
Mhm.
Like when we do an intake, we always conference.
Mhm.
So like I said, anything that you uncover, sasabihin mo dapat sa acupuncturist, and anything the acupuncturist finds or the chiropractor finds, it's always sharing of information and what you can do about it in your lane, in your
Mhm.
field. Like
Right.
for example, my example with the previous patient,
Mhm.
stagnant siya.
Mhm.
Diagnosis sa kanya ng acupuncturist is energy isn't flowing, very stagnant, almost to the point of toxicity, undernourished, ganyan.
Mhm.
So as a physical therapist, ano yung request ng acupuncturist? More
Mhm.
movement,
Mm.
specifically directed to the kidney heart area.
Mhm.
Okay, so I take that and then ano yung pwede natin gawin when he comes in, mag-warm up siya sa bike. Kidney heart area. So upper
Mhm.
X, lower X, bibigay ka ng stretches to open up the chest muscles. You're prepping the patient para mag-acupuncture. So
Mhm.
you stretch out everything that you can stretch out. And then after that, of course, the effects of stretching relax yung patient when they come into acupuncture. Acupuncture then relaxes them even more. And then, of course, yung treatment ng acupuncture has its own goals. And then when they go to the chiropractor, it's so much easier to do the adjustments and everything.
Does this
So
happen in all in one go, or do you, like every
Yeah.
one of you see the patient in one session?
Yeah. Mhm.
Oh wow.
Yeah. Kaya 1.5 hours per
Uh-huh.
session. Yeah. So it's very detailed, actually. So you remember specifically what works, what doesn't work. Like,
Uh-huh.
magbibigay ng feedback yung patient. I actually felt super exhausted when you put me on the bike, ganyan. So maghanap ka ng ibang way. Like, ano pa yung exercises na bibigay ko that opens the heart channel and the kidney channel
Mhm.
for the acupuncturist. And then, yung sarili kong assessment, like what do I see? Nasan yung patterns of dysfunction? Like makikita mo iba siya maglakad, dragging, ganyan. Ano yung kailangan ko i-strengthen? Ano yung kailangan kong i-stretch? It works.
Mhm.
It actually, hindi ko masyadong nagde-deviate into the psychological. The psychological part only happens when you're in the session.
Mhm.
So like CBT. CBT is always about redirecting thoughts. So cognitive behavioral is you redirect the initial thought so that the train all gets redirected.
Mhm.
So it happens in a session.
Mhm.
Ang mangyayari is while you're stretching the patient starts talking about, I don't know, but I believe that there's something about when you stretch people, when they feel a release, they actually voice out something that, that's been bothering them.
Mhm.
So then there's your opportunity. Now maybe if you try to think about ito, like maybe try to think about when you're in pain. And the number one I want to practice is think of pain as neutral. Yun yung number one ano ko. If you accept pain, it ceases to become your enemy. Yun yung sinasabi ko lagi. So you treat the pain as something is not in harmony in your body. And now we're working to harmonize whatever is not in harmony.
Mhm.
And we're looking to ease whatever is in dis-ease.
Mhm.
But for that to happen, you have to stop resisting pain.
I love that.
Yeah. Kasi pain is neutral, kumbaga.
Mhm.
Once they start accepting that concept that it's neutral, stop fighting it, nagde-decrease yung pain,
Mhm.
which is true.
Mhm.
So then after that, yung dis-ease, nare-relax.
Mhm.
And to my patients, I always say, nothing can resist a non-resistant person.
Mhm. Nice.
So if you're not resisting anything, wala kang mararamdaman. Okay, nandyan yung pain, okay. But if you consider it as neutral, and then you just tell it to leave your body, it actually leaves.
Mhm.
Kasi you don't recognize it as kaaway mo.
Uh-huh.
So we start with that, and then, the acupuncturist takes over, and then tapos na ako mag-stretch, and then they go back the same time again, and then another technique that we actually started using is, especially for stretching, we try to incorporate breathing. So the number one underutilized mechanism of the body is breathing. How many people in the world do you know actually take a deep breath every day? So now instead of stretching the patient and then counting, so usually we begin stretching, you hold it for 20 to 30 seconds, you do it 5 to 10 times, ganyan. We stretch a patient and then ask them to do 5 deep breaths. Because in that way, the muscle you're stretching actually moves by itself than just being, statically stretched. Diba?
Right.
And also, we take advantage of the benefits of deep breathing.
Mhm.
So they actually, and it's so amazing to see when you do deep breath holds, then just holds for stretching. Sometimes hindi mo na kailangan ulitin.
Sometimes hindi mo na kailangan what?
Hindi mo na kailangan ulitin. Pinagawa mo
Okay.
siya. For example, stinretch ko siya, and I
Mm.
said, take 5 deep breaths while I'm stretching you in this position. After that, we do it again. Sobrang stretch na, we don't even need to do it again.
Like that.
So that's what we found out
Uh-huh.
in our practice.
Mhm.
So yeah.
I like that. I like that when you say that you tell your patients that pain is neutral, because all our lives we've kind of villainized pain. That
Yeah.
it's not supposed to be there.
It's
You
not
know,
supposed to be.
that's what we were taught.
Mhm.
Pain hurts, pain harms.
Mhm.
That's it. We don't like pain.
Yeah.
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 I mean, sino ba naman yung gusto mo saktan, pero
Actually, yeah, wala na ako gusto
wala nang may gusto. Pero I mean, it's neither good nor bad. It's just there.
Yes.
That's a good
It's a
perspective.
marker. Like pain is it's neither good nor bad.
Mhm.
It's there to tell you something needs to be fixed
Mhm.
or something is not in the right place.
Mhm. Yeah.
So once you move past pain
Mhm.
and you actually look for why is it hurting,
Mhm.
then hindi ka na interested uminom ng pills.
Mhm.
Hindi ka na interested with surgery or anything. Which,
Mhm.
of course, I'm not opposed to surgery if you really need it.
Need it, yeah.
Yeah. Of course, if collapse na talaga yung vertebral column or meron na
Uh-huh.
talagang bone deformity or whatever,
Right.
of course, you need
Mhm.
it. But anything that is chronic,
Mhm.
anything that is chronic is always something caused by disease.
Mhm. Right. Kasi when there are pain, like we know exactly what it was caused, then it's easy to address, like mechanical
easy.
or like an ankle sprain.
Yes.
Alam natin, it's gonna heal at this amount of time and stuff like that. But chronic pain, especially, is very complex. That it needs more diving into, not just like you had this and we're gonna do this and that's it.
And because we're into a practice then combining traditional Chinese medicine. In Chinese medicine, unless your condition is caused by trauma. Like for example, syempre pag nabalian ka ng buto or binaril ka, whatever, then that's a different case. But anything outside of trauma that you just started feeling gradually or kahit biglaan, it's kind of like they consider it as more of an imbalance of something than an actual there's something wrong with you. It's not a disease. There's just an imbalance of something, and once you balance it out, it actually gets rid of your pain, your disease.
So you're working in a holistic clinic, and you're working with professionals that we traditionally don't work with as physical therapists.
Yeah.
How was that adjusting? Like, because they're with acupuncturists, in Eastern studies, they're like on meridians, on energy flow and stuff, chiropractors, adjustments and spinal alignments. How is that adjusting with their practice and including and putting in your foot there and including what your practice is about?
At first, parang it's very tricky. Kasi in some ways, your practice really overlaps with some of their practices. Like, naga-hands-on din yung acupuncturist, naga-hands-on din yung chiropractor. And then may massage therapist kami. So parang sa akin, bakit pa ako magmamanual? But then, when you know what you're bringing to the table, you never have a problem, actually.
Okay.
When you know what you're doing and when you know what you're bringing to the table in a practice, you never get lost. Because there's always something you can do that only you can do. So say for example, nag-manual na yung chiropractor, nag-manual yung acupuncturist, nag-manual na yung massage therapist, iba pa rin yung manual mo. Iba pa rin yung gagawin mo. Iba pa rin yung way kung paano mo hawakan yung patient. All the techniques are different. Even from one PT to another, iba-iba eh. Sure. Like your patients patients don't like it kapag pinapasa-pasa sila sa iba-ibang therapist.
Mhm.
Kasi iba-iba yung treatment style, iba-iba yung treatment technique. But yeah, you never, sometimes, yes, nag-overlap. But then, again, if you have very specific techniques and then you have different goals, like, for example, manual lang naman yung usually overlap.
Mhm.
Pero iba-iba yung goals namin for doing manual eh.
Mhm.
Like ako, ito yung gusto ko i-address, yung chiropractor, yung gusto niya i-address. Iba-iba kami nang ina-address. So in a way, hindi rin kami nag-overlap at all.
Mhm.
Yeah. Na mayroon kaming, like, na-maintain namin that we're staying in our own lanes and then we give what we do best.
Mhm.
Yeah.
And you said you talk to each other naman.
Yeah,
Communicate
always.
what you do.
We always communicate. Which is actually, I want to bring this up kasi there are so many times na in a practice, hindi may iwasan na meron kang ma-encounter na practitioners na sobrang yabang.
Mhm.
Know it all.
Yeah.
Or like, ang una nilang gustong sabihin sa'yo, nagpa-practice na ako for 30 years or 40 years. And gano'n.
Right.
Just to parang intimidate you.
Mhm.
But then again, you have to always be confident. Like for example, ako, I'm really into holistic practice.
Mhm.
And I have to be confident na kaya kong gawin yung holistic practice. Otherwise, talagang makakain ka ng someone who has 30 years of experience or something like that. Of
Right.
course, they know and they've seen more things than you've seen. Pero you're just as capable.
Mhm.
Ngayon, kapag ang goal talaga ng practitioner is talagang agawin yung spotlight or, fully gusto niya sa kanya yung pasyente, doon nagkaka-problem. And I remember having that same situation. Meron akong naka-work with na parang 60 plus na siya na physical therapist. And parang sabi niya, I have 30 plus years of experience, ganyan-ganyan, with all of these situations, ganyan. Tapos sabi ko, by telling me I have 30 plus years of experience, all I get is that you're old.
You said that.
You're just telling me you're really old.
Oh, man.
Kasi iba pa rin yung gagawin niya sa gagawin mo. Parang sa akin, yung pag-layout mo nung years of experience mo as to what we're discussing right now, na you're not even paying attention to what we're trying to do as a team and yung goal natin, but you wanna keep pushing na meron kang experience sa ganyan.
Mhm.
Okay, then i-share mo. Stop bragging about it. Ano yun? Di ba? Parang ganon. Kasi kung hindi mo rin i-share, then all you're really telling me is you're really old.
Like
So, yeah.
they're expecting everyone to fold just because
Yes.
he put down the age card and the experience card.
Exactly. Sobrang funny. Which I didn't mean to say that. Pero at that time kasi parang ako, we're all wasting our time kung ang sasabihin mo lang sa akin is may 30 plus years experience ka. Okay, lay it out. Ano yung gusto mong matutunan namin or gawin namin based on the 30 years? Diba?
Right. Jesus Christ. Mga ganyan talaga mga tao, hindi may iiwasan.
Yeah. And marami pa rin hindi naniniwala sa holistic, which is mind-blowing. Like, right now, for example, meron kaming patients na hindi pa rin sila naniniwala sa traditional, sa Eastern medicine.
Yeah.
Like, Eastern medicine has existed thousands of years, like even longer than, diba, Western medicine. But there's always, for some reason, nagka-clash. Parang sa kanila, either or.
Right.
Either pupunta ako sa doctor, or magpapatherapy ako, or mag-acupuncture ako, or inom ako ng herbs. It's either or. I always say, why don't you do both? Yeah. Kasi, holistic means you're taking the whole. Diba? So when you take the whole of a person, like the whole being, it includes anong diet nila. Ano yung thoughts nila within a day. I have actually asked the patient to write down his thoughts for the whole day para lang ma-prove ko sa kanya na negative siya mag-isip. Sabi ko, certain moments of the day, write down what you're currently thinking. And then nakita niya, oo nga, gloom and doom lahat. Sabi ko, you start with that. Diba? And then, so yung nutrition nila, anong kinakain nila in a day, and then what are their thoughts? What do their thoughts look like mostly within the day? Ano yung ginagawa nila? Are they just sitting around all day, or are they actually doing something productive, or they try to do something relaxing, self-soothing? And then there's also working on spirituality if they're into that. Pero dito sa New York,
not so much.
So not too much. Spirituality means maraming practitioners of spirituality
Mhm.
who don't believe in God.
Mhm.
Interesting. Pero yun.
Ah.
So they also delve in the spirituality aspect of a person,
Mhm.
and then relationships wise.
Mhm.
And then there is another thing we call in psychology yung inner child working, like
Mhm.
helping your inner child, shadow work, bringing out all yung tinatago mong shadows and stuff from your past
Mhm.
that you completely forgot about, that you don't know are still influencing your decisions and your reactions to everything today.
Mhm.
Those things, pag sinabing holistic, lahat yun kasama.
Mhm.
Actually, icing lang yung, and then I'm going to stretch you.
Yeah, I mean, for me, when like articles or posts like that about chiros or acupuncturist are coming out like there's no evidence in acupuncture and stuff like. Well, it existed for millions of years. I mean, thousands
Yeah.
of years. Sorry. So, diba? I mean, if we can work together, why not?
Mhm.
What's our beef against someone? They're also
They're
trying.
only trying to help. They're
Yeah,
only trying to help.
diba?
The other thing sa akin about, like, of course, we're scientific people. Nagbabasa
Mhm.
tayo ng medical journals. Nagbabasa tayo ng research. Ganyan.
Right.
But you have to take everything with the thought of, you need to remember that you are living in a corporate society.
Mhm.
Meaning, as a pharmaceutical company, I can pay anyone to say that this doesn't work.
That's true naman din.
I can pay any research
Mhm.
para sabihin na itong technique na to, that is an alternative to my solution,
Mhm.
doesn't work. That
Mhm.
placebo is better. Or, it's very easy to manipulate
Mhm.
things. And
Mhm.
then, meron akong practitioners na nami-meet na galit sa placebo.
Mhm.
Like, lagi nila sinasabi, placebo lang yan eh.
Uh-huh.
Tapos parang ako, kung gumaling siya dun eh.
Uh-huh. Exactly.
Kung gumaling siya dun, ba't ka galit dun sa placebo?
And
At
then
least gumaling.
and then the patient's mind healed himself, and why not?
Why not?
Why
Exactly.
not?
Parang if it works, ba't ka galit?
Exactly.
Yeah, so I agree with any treatment that works as
For our
long as
patients.
it's healthy.
Mhm.
Yeah.
As long as it's safe, it's
As long
not.
as safe, healthy, you're not asking them to ingest anything out of the
Mhm.
ordinary. Wala
Right.
kang pinapagawa na ridiculous
Mhm.
practices.
Mhm. It's not
Then I
for
agree.
the patient and that.
Yes.
And you've mentioned as well with talking with patients, sharing their stresses,
The
their
burdens. Yeah.
disease,
Yeah.
their qualms, whatever.
Mhm.
It can put a toll on you
Mhm.
because so how do you handle, because at the end of the day you've listened to a lot of patients
Mhm.
vent out. So how do you handle that? How do you take care of yourself? Because there's something called vicarious trauma wherein you feel the trauma of the other person just by telling their stories to you. And it's
Mhm.
hard, especially like if any practitioner is like working in a mental health and um
Mhm.
psych area. I learned that the hard way.
Ah.
Because I had a lot of patients vent out their stuff with me. My
Mhm.
population is incarcerated population, so
I see.
stories in prison and stuff like that.
Yeah.
And that, for me, I want to say I'm an empathic person. I want to bring
Mhm.
out that relaxedness to a patient when I'm treating them. That's why I want them to keep talking, so that they're
Mhm.
at ease with me. But sometimes it comes to a point that it becomes heavy and heavy and heavy. So
Mm.
how do you handle that? How do you take care of yourself?
Mhm. So I'm a firm believer in, you cannot feel, you cannot give, and you cannot give out from an empty cup.
Mhm.
Diba? So ikaw as a person, dapat yung mental health mo is in check
Mhm.
before you attempt to help other people with their mental health. Diba?
Right.
So I make sure that I check on myself first
Mhm.
before I go to work. I don't know if a lot of people are doing it, or like the listeners in the podcast, but I believe heavily in meditating
Mhm.
every day. At first, di ako naniniwala sa meditation. As
Mhm.
in, And I found it so hard to sit in silence for 1 minute. Like, tinry kong mag-meditate. The first time I tried to meditate, parang mag-1 minute pa lang may nangangati na or may naiisip na ako na the purpose, until nag-catch up na ako ngayon dun sa meditation, and I found out na the purpose of meditation is not to empty your mind. It's to actually be able to pick the thoughts you want.
Like
So
that.
you pick what you're focusing on. You can never empty your mind. You cannot.
So that's what I'm trying. That's what I'm doing wrong, because I was trying to empty my mind when I tried to
No.
meditate.
So sinabi yun sa akin ng doctor of acupuncture. Sabi niya, if you're meditating and you're trying to empty your mind, then you're never going to be successful emptying your mind. It's kind of like saying, don't think about a pink elephant. Nga daw.
And you're thinking about the pink.
Diba? So sabi niya, it's not the focus of meditation. The focus of meditation is ikaw yung nagdi-dictate ano yung gusto mong isipin. Ano yung saan mo gusto mag-focus on. So there are days that you meditate and you're not thinking about anything, pero pakikinggan mo lahat ng sound sa paligid. Because you choose na pakikinggan mo lang yung sound sa paligid. Pag may nag-cross na thought sa mind mo, wait, pakikinggan ko ulit ano yung naririnig ko. Yung ibon sa labas, may cars, ganyan. Yun yung meditation. Tinuturuan mo yung mind mo na ikaw yung masusunod. So ngayon, in the active world, after mo mag-meditate, pag may naisip kang thought, ikaw ngayon mag-decide kung gusto mo isipin yan or not. And then it doesn't bother you. So, sabi ko, wow, hindi ko na-realize na ganun pa rin meditation. So now, sobrang easy na mag-meditate kasi yung pala, mag-focus ka lang on something that you want to focus on. And if a trespassing thought comes in, babalikan mo lang yung thought na gusto mo. And then, you become kinder to yourself. Kasi at first, naiirita ako na, bakit hindi ko maisip yung gusto ko isipin? No, pag naisip mo, just go back. Keep going back dun sa gusto mong isipin. And eventually, you do train yourself na spectator ka lang dun sa thoughts mo. So ngayon, paano yung nagtatranslate into reality? Kapag meron akong thoughts or may na-encounter ako in reality, kaya ko ngayon na observer lang ako. Hindi ko kailangan maging involved. Hindi ko kailangan maging attached dun sa sinabi sa akin or dun sa ano. Lalo na pag empathic ka, mabilis kang ma-exhaust. Mabilis kang mapagod kapag kinukwentuhan ka.
Sure.
Pero kung kaya mo mag-detach from the story, and another thing that meditation teaches you is everything is neutral. Yung story na sinabi sa'yo, hindi yung good or bad. Story lang siya. It's the feelings you associate with it that make it heavier or lighter. Tayo nagde-decide kung happy yung story or not happy yung story. Bibigyan kita ng example. May taong nakulong kasi may pinatay siya. Happy yung story or not happy yung story? Hindi happy yung story sa family niya, pero dun sa family nung kabila, happy yun. So you see, everything is neutral until tayo yung magbigay ng interpretation. So ganun yung ginagawa ko. Hindi ako mababother dun sa kinukwento sa akin kasi para sa akin, neutral lahat ng kwento mo. Parang I respect your story and I accept what you're feeling. Like I respect what you're feeling right now. Pero to me, it is all neutral. It is a process you're going through. It is a process you will eventually over. Like, papunta sa kanya, hindi papunta sa akin. Yun.
That's good. That's good.
Ganun yung...
You
ganun
acknowledge that experience is theirs.
Yes.
Not mine.
Not mine.
Your experience is yours. It's valid. I acknowledge that. But that's yours.
But that's your story.
Okay.
Kasi sometimes your burden comes from thinking that when somebody tells you a problem, you should solve it.
Yes. And that it should also be your problem.
Yeah. Or like, kailangan tulungan kitang hanapan ng solution. Yeah. Sometimes, no. Kailangan lang lumabas ng problem para nasa surface na siya. And then, it's the person's process. Even in your own relationships, even in your own family, may pagdadaanan yung family mo, but you don't need to be associated with it because it is their story. They need to figure it out. You do not have to do it for them. In a matter of fact, if nag-interfere ka, mas lalong lumalala pa minsan. So everything is neutral. In your plane, unless it's your problem, everything is neutral. And then you don't feel burdened. And again, meditating helps you focus on spectator lang ako. Pakikinggan lang kita. And then self-soothing activities. The other thing that I only learned recently is yung self-soothing.
Mhm.
Self-soothing means you find something that calms you down.
Mhm.
So sometimes, umupo ka lang, makinig ka sa music. For the sake of listening to music. I don't want to feel any emotion with the music. I just want to listen with the music. Diba? Some people put on music kasi gusto nilang ma-feel yung lyrics or yung whatever. Gusto kong maging mas malungkot kasi malungkot ako ngayon.
Oo,
Yan.
makinig kay Moira.
O yung mga ganon, di ba? Para sa akin, you need to do self-soothing. Kailangan ma-practice mo na in charge ka lagi.
Mhm.
Like, I'm gonna self-soothe right now. Makikinig ako sa music for the sole purpose of marirelax ako.
Mhm.
Diba? The thing na na-realize ko that I was doing before is gagawa ko ng activities para ma-encourage yung emotion ko.
Mhm.
Now, by doing that, na lagi kong ina-uplift yung emotion ko, nawawalan ako ng control sa situations.
Mhm.
Kasi I always react emotionally.
Mhm.
I make decisions emotionally. I talk to people emotionally. So everything is emotionally.
Mhm.
Until na-control ko na yung emotions and parang observer ka na lang.
Mhm.
Then mas may reign ka sa sarili mo. Kaya mong sabihin sa isang bagay na neutral siya. It's actually your ability to say something. You are neutral.
Mhm. How would you differentiate being neutral to being indifferent?
Like I said, being neutral means I accept
Mhm.
whatever this information is.
Mhm.
I understand. It is valid.
Mhm.
Being indifferent absolutely eliminates all validity.
Mhm.
Kasi pag indifferent ka, hindi valid sa'yo yung tao, hindi valid sa'yo yung idea, hindi valid sa'yo lahat nung nasabi sa'yo.
Mhm.
Kaya masakit kapag indifference.
Uh-huh.
Sabi nila, the opposite of love is not hate, it is indifference. Diba?
Exactly.
Kasi mas masakit yung indifference kasi hindi ka na valid.
Mhm.
Hindi ka na tao. Hindi ka na
Right.
valid eh.
You don't exist.
Yeah. Yung neutrality is, you're still valid.
Mhm.
I hear you.
Mhm.
You're seen, you're valid, you're accepted.
Mhm.
It's just that it has nothing to do with me.
Mhm.
Yep.
Gotcha. Wow. So, I really enjoy our conversation.
Yeah.
It's like extended tayo.
Yes,
We can probably talk
Sobrang
more.
lawak kasi ng topic.
I know, and I didn't even ask some of my questions. But probably we can continue this another day.
Part 2.
Yeah, I know. So as a closing, I have my last
Yes.
questions. First is, what's your recipe for success?
Recipe for success.
Mhm.
Again, focus.
Mhm.
There is a saying, if you aim for nothing, you hit nothing. So, focus on what you want.
Mhm.
Kasi kung hindi mo alam kung saan ka papunta, saan ka pupunta? Diba?
Exactly.
So, definitely success is alam mo kung anong gusto mo.
Right.
You cannot rely on people telling you what you want. You cannot ask your partner what they want and then, gusto ko rin nun. No. Think really. And it's a very hard process actually to think of what you want.
Mhm.
And that's where it all starts. Be absolutely clear what you want.
Mhm.
Yung clarity, consistency, and certainty. First of all, kailangan clear ka ano yung gusto mo. You want money? How much?
Mhm.
You want a house? Ilang bedroom?
Mhm.
Consistency, you don't stop
Mhm.
until, like for example, gusto kong magkaroon ng ganito, gusto kong magkaroon ng sariling clinic. Okay, ano yung first step? Gain some experience, work in a clinic. Yan. Consistency. Next, maghanap ng investor.
Mhm.
Maybe ask your friends, ganyan. Next is certainty. Like, I know what I want, I'm working hard for it, so I'm sure I'm gonna have it. Certainty.
I
Yeah.
like that. I like that. Maging tayo sa C's.
Yeah.
Competence,
3 Cs.
compassion,
Commit.
commitment. Yeah. Like clarity,
Clarity,
consistency.
consistency, certainty.
I like that.
Para sa akin yun yung recipe of success. Yeah.
Next bite is, how do you sharpen your knives? How do you continue to develop yourself?
How you continue to develop yourself? I have this practice that I always try to do, that I only talk to people many years younger than me and many years older than me.
Mhm.
Kasi you rarely learn anything new from someone your own age.
Mhm.
Either I talk to young kids,
Mhm.
and it's so funny kasi yung simplicity nila, masashock ka. Biglang
Oh, as in
eye-opener.
kids.
Kids. Like, I
Okay.
talk to 6-year-olds, 7-year-olds, ganyan. Nag-PPRN ako sa PIDS. So sometimes, may nare-reveal sila sa'yo, simple concepts, but then you're like, wow.
Yeah.
And then the flip side is really old people, Jerry.
Mm.
Ang dami kong natutunan. That's how I sharpen my knives. And then, of course, I try to be in touch with what is happening now. Like, for example, ano yung gusto nating ma-improve within our practice. Number one I advocate for is mental health. So I try to learn as much as I can about mental health.
Mhm.
Number two, yung overworking, the
Mhm.
burnout
Mhm.
in healthcare workers, actually. It's very popular now. So the burnout, I try to learn about, paano natin matutulungan yung physical therapists from getting to a point that they're really burned out and then they get depressed, stuff like that. So, and then another is I'm an advocate right now of immigrants in crisis, as in healthcare workers. Like, I've seen it. I've seen the trend in the last few years that it gets easier to come to America kasi yung clinics, they offer you green cards, working visas, pero sobrang dangerous ng situation. You get 4 or 5 patients per hour.
Oh, the PT meals.
Yeah.
MILLS. Not my
Sobrang,
podcast.
yeah.
Yeah.
Sobrang dami ngayon na kawawa sila. The new grads have absolutely no idea. So I want to raise awareness with that too. And then, of course, they're bound by these contracts. Di nila alam yung pinipirmahan nila, yung mga ganyan. So whenever I get the chance, like sinasabi ko, hey, nabiktima din ako ng ganyan. Sabihin mo sa friends mo, ganyan. Yeah.
That's another topic for our podcast.
Interesting, right?
Really
Yeah.
interesting. I mean,
Yeah, yung mga immigrating PTs is a number one, like, they have my heart. Kasi marami napapagsamantalahan because they don't know what they're signing. They don't know what a non-compete is. Imagine mo, dito sa New York City, sasabihin, you cannot work for the next 7 years within a 15-mile radius of New York City. Parang ako, New York City is 15 miles. So bawal siya mag-work sa New York City for 7 years after working for you, and then they sign it because they don't know. So yun. Like, if
these are the young kids that are excited to come here.
It's crazy. And then sasabihin sa kanila, hindi, normal lang yung 4 patients per hour. Meron nga kami 6 pa per hour. And I'm like, that's not a badge of honor. Don't say yes to that. No. Yeah, so yan. Sharpening my knives is like, yeah, I have to be involved in something that changes things.
God.
Yeah.
Think about your license.
Exactly.
Think about your documentation.
Not only that, imagine mo, magsasign ka for 3 years or until you get your green card. That's your life. That's 3 years of your life. No amount of money can buy your time. So yan.
And I bet they're getting the minimum wage.
Oh yeah. I mean, the worst case scenario pa, like, I don't know if you're aware of this, pupunta sila dito as PTAs.
Oh, even though they are
they're licensed PTs.
Okay.
Mag-working sila as PTA kasi wala pa daw jobs for PTs. Tapos parang ako,
wait, how should they work as a PTA if their license is a PT?
So pinakuha sila both exams.
That's why I always see that people passing both PT and PTAs. No,
yeah. Kasi daw mas madaling ma-approve for green card pag PTA ka muna tapos ipi-PT ka na lang after nun. Pero babayaran kita ng 28 per hour.
That was New York. Oh my goodness. Oh man. That's why.
Diba?
At first, I didn't know that. Akala ko, they would take PTA because gusto talaga nung person to take a PTA exam.
Mas madaling magkaroon ng green card kapag PTA ka.
Kapag sasamantalahan. Yes. Oh my goodness. I feel bad for them.
You have a good platform. So we need to help these young kids. We need to help the people right now who are stuck in these situations. Tapos ang gagawin sa kanila, babawiin yung green card. Now they're stuck here. Wala silang status. Yeah.
How do you mean babawiin yung green card?
I-retract kapag...
yung application, i-retract. So they're here on a working visa. So hindi sila makakawala.
Yep.
Oh, geez. A lot of segue na naman tayo.
No tayo. Okay lang yan.
I have some new grads who are asking me, sir, okay lang bang pumirma ako about ganyan-ganyan. Sabi ko, because I haven't seen the contract, so hindi naman makapagbigay ng masyadong um advice. Pero yeah, they were asking, okay lang ba ganito? Okay lang ba ganyan? They said that their timeline is, I mean, 10 years or 5 years or whatever. They're gonna get their DPT or whatever. And I was like, okay, I can't really say anything now because she already, signed.
Yeah.
So, I mean, if before siya mag-sign, siguro mas marami pa akong mabibigay. Pero
Yeah.
they already signed it. So, I don't have any power anymore kasi hindi naman nila pwede i-retract yung signature.
Yeah, pag sa akin, may nagtanong, sinasabi ko lagi, can I see your contract? Sabi ko, you can blot out details if you don't want me to know how much you're making, whatever. Pero let me see the contract. And then, maraming ridiculous clauses talaga na nilalagay doon na hindi alam nung tao na what you're signing up for. Like, oh, we're gonna sponsor your DPT, but we're gonna give 2 extra years for us. Ganyan. Yan. Parang pinagpapatong-patong, and then eventually it takes 7 years ka nang nag-work sa kanila, wala ka pa ding papers. It's ridiculous. It's really ridiculous. It's modern day slavery, actually, is what I call it. And laging ang nahuhuli is yung mga bata pa that they're coming over, and of course nakakaengganyo kasi yung pera. Pero once nandito ka na and na-realize mo ang hirap pala ng work, and ito pala yung pinirmahan mo, and ang dami mo palang ganyan. Akala nila basta-basta yung, oh, may insurance daw ako. No, ask how much you're paying for insurance. Meron akong kilala, sinabi may insurance coverage siya. 700 a month pala yung babayaran. Hindi nila alam. So, yun.
Kalaki,
Yeah, so para sa akin, we need to help. Like, I try to keep up with the current issues para makatulong. Yeah. Like, at least I can change something.
Yeah. We should do that.
We should do that, yeah.
Whew, how was sharing?
Diba?
Pag-usapan natin yan. Paano tayo makakatulong sa kanila?
Yeah.
All right, my last bite is, what are the 3 ingredients that you always carry with you no matter where you go that you think is essential? In short, what are the 3 ingredients that make up Reg?
Number 1 is kindness. So you don't know if you don't know kung ano yung pinagdadaanan ng person na mamimit mo today. You don't understand if you're the last person they're going to talk to within the day. So you always need to be kind. And then the second one is, don't expect life to be fair. Yeah. Kasi we come into a lot of situations na galit tayo because hindi tama yun. Hindi You always have to go beyond what's fair. Like, why you? Sipin mo bakit ikaw. May reason lagi. More than just fair or unfair. May reason lagi. And then the third one is empathy. Like, before ako makipag-away, usually I try to practice before ako magalit, before ako makipag-away, itatry ko munang ilagay yung sarili ko sa paa niya, sa shoes niya. Sorry. Na, bakit kaya ito yung ginawa niya? Bakit kaya ito yung sinabi niya? Kasi usually people are not angry about what they're angry about. So, hindi talaga yung iniwan mo na something. Hindi talaga yung coffee yung pinag-awayan nyo. It's something else.
Right.
Yeah. So, I try to be compassionate and, you show empathy. Yeah.
All right.
That's it.
Don't expect life to be fair.
Yes. Don't expect life to be fair.
I like it. All right. Again, thank you.
Yeah.
And I really enjoyed it. I mean, I wasn't able to ask my questions that I prepared, but I feel that what we discussed was more important than that.
Yeah.
So, with all that we talked about and you shared, what do you want our audience to take away, yung ibaon nila in their practice from our conversation?
From our conversation, like I said, you're a key participant in someone's recovery. Actually, let me rephrase that. In everything, not just patients. You're either a key participant in the solution for their lives or in the breakdown of their lives. So, you either propel them to health or ibabagsak mo sila. if you're not part of the solution, you're part of the problem. So try to be the solution for everybody in whatever way you can.
Mhm.
Yeah, like if you only, I'm not saying everybody should get into holistic practice, but if, for example, ang talent mo is stretching, then be the best in stretching. If you're the best in exercise, be the best in exercise. Whatever you can give to help someone, just always help. Yeah.
Right. And even if they're not into, I mean, our audience is not into holistic practice,
Mhm.
but recognize that someone is a person. That's
Yes.
the least that you can do.
Yeah.
Bare
Yep.
minimum.
Like I'm saying, lagi kong sinasabi, every person is valid.
Mhm.
Yeah. So try to practice na, okay, I'm not attached, but you are valid.
Mhm.
Yeah.
Right.
And that's enough for some people. That's actually enough.
True. True.
They're just a person.
I
Yeah.
agree. I have patients tell me that, you know what? You're the first person that really tried to hear what I was saying. I was like, oh,
Yeah. See?
oh.
Yeah, if you can treat somebody as a person, you don't realize you don't realize how lonely people are or how many times they've been treated as inhuman, actually, diba? So,
Even if you
yeah.
think your patient is being malingering or
Yeah, even if
catastrophizing,
iniimbento na lang or
listen to
ginagawa na
them.
nilang daycare yung clinic nyo, nagbabayad naman siya, ba't ka galit? Yung ganun.
I mean, exactly. I mean, if you can make that person a little bit better, why
A
not?
person believes gumagaling siya sa steam and heat. Why not?
Exactly. All right.
Okay.
If I believe that our message here
Mhm.
would resonate with other PTs. Where can they where can they reach you if they wanna stay connected with you and ask you about this stuff?
Oh, Instagram is the best.
Uh-huh.
Yeah, so Instagram or Facebook. Yeah.
Okay. Right.
Yeah, I think I'm on your platform. Like my link
Yeah.
is on your
Yeah.
platform. So yeah,
I'm gonna.
if they have questions or interested in citizens of practice or like resources or something like that, or they're in New York, ganyan.
Oh yeah.
Yeah.
Say hi.
Yeah. Say hi. Yeah. So
All right.
yeah, social media is still the best platform for
Okay.
me.
I'm gonna post that in the show notes as well so that they can reach
Yes.
the
Yes.
website.
Thank you.
Her bio is there, just
Yeah.
that link, and you'll get to her social media apps.
Yeah.
Okay.
Yeah. Mhm.
All right. Again, thank you very much, Reg, for coming to the
Thank you for having
podcast
me
and
so much.
sharing with us that. Sobrang dami ko natutunan this way. So, to everyone's listening, watching, catch us next time with another episode of PTM Podcast.
Uh-huh.
Thank you very much,
All
everyone,
right. Thank you,
and
Dan. All right. Good
stay
night.
safe.